The featured company is a paid client of Proactive Group Holdings, and this recording is disseminated by Proactive on its behalf.
All right, welcome back inside our Proactive newsroom. And joining me now from our OTC studios in New York City is Dr. Bill Cherniak. He's the CEO of Rocket Doctor AI. And Dr. Cherniak, great to see you. How are you?
Hey, I'm good. How are you doing?
I'm good, good, good. We'll talk about what you're doing in New York City and the OTC in just a minute. But first, for those maybe not familiar, and I'd be surprised if anyone was, because we've heard a lot about Rocket Doctor. Tell me a bit about the company.
Yeah, so basically, Rocket Doctor AI, as the publicly traded parent, takes physician clinical guidelines and decision to create AI supports along the entire spectrum of the patient journey. Within Rocket Doctor AI is Rocket Doctor Inc., which is a Shopify for physicians, helping doctors build and scale our own independent practices, largely virtually, but in some hybridized in-person virtual models, putting it onto all of that technology with a proprietary AI-enabled EMR, putting out to patients primarily in rural and remote communities across Canada, and then on Medicaid and Medicare in the US market.
This company was kind of born out of frustration, I think, on your part of trying to get patients to get the medical services that they need.
Exactly, yeah. As an emergency physician, working both in urban and rural centers across the country, just seeing tons of patients coming to the hospital that have outpatient primary care issues and really didn't need to be in the emergency department. And so I was thinking, if we could use technology and diagnostics and AI tools, we could try to take away some of the administrative burden and help people ultimately access care in the right place at the right time and avoid those unnecessary trips.
I know since we went through COVID, there's been a big push to more online, and you've sort of situated the company perfectly for that sort of explosion right outside of COVID. The government supporting you, there's a lot of things that are really positive for the company. Is that fair to say?
Yeah, I mean, we've been fortunate. We just announced last week $100,000 worth of funding from two Canadian federal government agencies, both to build and scale some of our technology and also to export the product to the United States market, which has been great. And then we empower physicians across Canada to bill provincial health insurance wherever possible. And so, to that extent, the provincial codes largely support virtual care and digital health, and we're building a system that works within the existing infrastructure for that.
In my career, I've covered a lot of healthcare, and one thing that is true through a lot of it is the fact that patients have better outcomes and survive longer while they're being treated at their own homes. They feel more comfortable. It's less stress. Do you find that as well? Is that an accurate of these reports that I read?
Yeah, I mean, as an ER physician, I would say that sometimes you definitely need to see us in the hospital if you're having,
Sure.
a heart attack, stroke, you got a broken bone, the ER is the right place for you. But absolutely, the vast majority of patients don't need that. And, we often ask people to come to us in these kind of clinical, sterile environments. You got to, drive out, take a day off work, pay for parking, as opposed to simply being able to connect with you like this, wherever you might be at home, and, understand a little bit more about the way that you live your life. It actually helps to impact the healthcare that we do for primary care. So whenever possible, definitely trying to bring healthcare into the home will improve outcomes.
Yeah, let's talk about the US. You're at the OTC in New York City. The US obviously a key market, I would imagine, as is Canada. I know that I was reading some news recently that you signed some insurance companies in California and New York State, about 7 million insurers on that one. This is obviously a pretty prime market for your company.
Absolutely. And so my background personally is I've gone to school and then worked clinically across the United States. And so it was always a focus to bring Rocket Doctor south of the border. And we've tackled the closest thing to the Canadian health insurance in America, which is Medicaid, and then Medicare as well, which are government funded health insurances. So that announcement that you noted, that we now want to contract with different major commercial insurance companies across the country. We also are in network with Medicaid in California, New York, Maryland, Medicare, Medicare Advantage, and we announced another four different insurance companies across the United States that we are now in network with, which means basically docs that are on the platform in America are able to take the insurance of these different big companies, which means our market is now dramatically expanded for who we can see on the platform.
Absolutely. And also there's a large investor base, obviously, in the US that sees the future of this type of service.
Absolutely, for sure.
Yeah. Dr. Cherniak, thank you so much. Great to see you. Congratulations on the success, and we look forward to following your story as it continues to develop, okay?
Awesome. Thanks, Steve.
All right, there's Dr. Bill Cherniak, the CEO of Rocket Doctor AI from our OTC studio in New York City.
The featured company is a paid client of Proactive Group Holdings, and this recording is disseminated by Proactive on its behalf. It is for informational purposes only and does not constitute investment advice, an offer, or a solicitation to buy or sell any securities. Viewers should conduct their own research and consult a qualified financial advisor before making investment decisions. The views expressed are those of the speaker and do not necessarily reflect those of Proactive Group Holdings, trading as Proactive Investors, or its affiliates. No responsibility is accepted for any loss arising from reliance on the information presented.